Well, hello everybody. I'm Dr. Glenn Harrison, and welcome to this week's episode of Why. This is where we take just a few minutes to answer some of the most common health-related questions that I see in my office every day. So the question is, and I see so much of this, Dr. Harrison, I have this pain that's bothering me, hip, knee, back, neck, hand, wrist pain that just keeps going and going and going. And how do I get rid of it? Well, this is probably a chronic condition. So by definition, chronic means if the symptom is going on for over 3 months, that's really what chronic means. So chronic joint pain is something that's been going on for over 3 months. Now, there's many causes of chronic pain or joint pain. It could be accidents, injuries, trauma, car accidents, sometimes even infections. Or wear and tear and arthritic conditions. So there's many causes of chronic joint pain. But what I want to introduce in this video is there's a few therapies for chronic joint pain, and there's a big picture to chronic joint pain and what can be done. So first, maybe the ones that we've mostly heard of, or the mainstream ones, our medical approaches to it, is injections and drugs and painkillers. Now, there is a place for these solutions, but we tend to become dependent on them and addicted to them. But there is a place. Sometimes that's what it takes. But there is addictions associated with these pain medications and all of that. So that's the medical model's approach, pharmaceutical or surgical. And then there's another category. It's the acupuncture, the massage therapy, the chiropractic. That is a passive form of care, meaning the patient doesn't do anything. They rely on the doctor or the physician or the provider to work on them. This is good. In fact, chiropractic care is seen to be one of the best and the fastest therapies to reverse acute conditions of joint pain. If you get into a trauma or an injury or something like that, chiropractic is the fastest to get you moving. And the other ones are very helpful as well, but they're passive, meaning you don't do anything. You have to rely and depend on another provider to help you and fix you. There's a benefit for it, but that's the downside. And then there's another form of care is physical therapy. Usually that's active, meaning the patient has to do something. This is really good because the physical therapist will hopefully train you and teach you on what to do to get rid of that pain, that joint pain, musculoskeletal pain. But then there's one that not too many people that I see are aware of. That's the one that we use every day. And that's addressing the inflammation in the body to reduce the pain in the joint. It doesn't matter where the joint is in the body. We see musculoskeletal conditions as a side effect of inflammation in our body every day, meaning we see joint pain in our office and muscle pain in our office, where people went to all the therapists and they got some help from it, but they had to keep going and keep going and keep going, or sometimes they never got the results they wanted. We don't work on joints and muscles in our office, but we address inflammation, and it's huge. It's remarkable. The majority of people get significant outcomes, the vast majority, and we're not working directly with the joint or the muscle. So what is inflammation? Inflammation is the body's response to some irritant. Now, there can be many things. If you injured yourself or have an arthritic condition or so on and so forth, that's an inflamed and injured joint or muscle. But any other thing in your body, any inflammatory exposure to a food, a chemical, a stress, will naturally make that joint much worse. So by addressing the things we can do, we can actually heal the joint and get rid of symptoms or significant parts of the symptoms pretty quickly. So how do we do it? Well, there's a few things that can be done. Simple ones, just for the video today. One is sugar. Sugar is bad. The body responds to sugar by driving up insulin. We need insulin, but insulin is the most inflammatory thing to the body. So pay attention to the sugars, the sweets you're exposed to. Start getting rid of that. And don't ignore breads and grains and all of that, because that usually turns into sugar in your body. Your body makes more insulin, and that's more inflammation. And if you have any existing injury or problem in your body, in a joint or a muscle, it makes it worse. Okay? So foods, in a nutshell. Sleep, this is massive. We need to allow for 8 hours of sleep and hopefully get there. If we're sleep deprived, that is an irritation to the body. aggravating adding more inflammation to an existing inflammatory condition, making it much worse. Make sure you're getting your sleep, high quality sleep. I've done videos on this. You can look back in those. And then another one, we got to move. We absolutely have to move. Of course, if you have a lot of joint pain, rheumatoid arthritis, things like that, where we have a hard time to move, weight-bearing exercises are painful, go to a pool. That can be remarkable. But you have to move to move the fluid through your body and get the toxins and cut down the inflammation. You have to move a little bit. It could even be 15-minute walk a day to start with. So move. So to take a step back, to address inflammation, definitely look at foods, get some movement, and make sure you're sleeping. They sound pretty abstract relative to joint pain, but it's absolutely huge. And there's so many other things. And I guess there's another thing, is gut function. When there's a problem in the gut, digestive issue, bloating, gas, diarrhea, constipation, just pain in the abdominal region, that is a massive inflammatory fire that will aggravate any other joint problem. And how do you work with your gut? Well, find a provider that's going to look at all the things, your foods, look for allergies, sensitivities, all of that. Of course, sugar makes the gut worse, and junk food and all of that stuff will make the gut worse. So work on your gut, address the sugar and things that drive up sugar in your body, like breads and cereals and grains, and then get some movement. And of course, sleep. These are amazing things. Now, when you do all of this, not necessarily your joint pain is going to go away tomorrow, but give it a few weeks and you will see remarkable changes in that. So in a nutshell, focus on inflammation. The other strategies are very helpful, but if you want to maintain your body and preserve the tissues and not depend on someone else, be health independent, focus on inflammation and you will see your joint pain melt away. So with that being said, I'm Dr. Glenn Harrison. If you know of anybody dealing with these challenges, send them this video. They may have thought about this inflammatory piece, and they can get their health back and get rid of this pain. And I guess that's a wrap. So I look forward to talking to you next week. We'll address another why to another health-related question. Have a great day.